it's a good time to really reflect on the faculty's role, and we will be looking at tweeting and reflecting on the agreement, particularly this afternoon as we hear more. So without further ado, I'd like to hand over to Kevin Fenton, our president, who is going to chair the first hour of the session. Kevin, over to you.
Lovely. Thank you very much, Paul, and good afternoon, everybody. Paul, thank you so much for opening today's event and also for your leadership as chair of our Climate and Health Committee. I'd also like to thank members of our Sustainable Development SIG, including our co-chairs Maria van Hove and Anja Gopfert, for their work in pulling together today's event and for their leadership in this most important area. And as Paul has said, we have been closely watching proceedings at COP28. There are a lot of recent important decisions which have been made in the past 24 hours, which, as Paul said, we're still digesting. But we realize that for this agenda, we need to move further, faster, and more impactful. So I'm hoping that the time that we have together today will help us to reflect on what has proceeded, but also to strategize on what we do next as a faculty and as colleagues working in public health. Now, the Faculty of Public Health, as you know, has recognized climate change as the greatest public health threat of the 21st century, and it is a core responsibility for the public health workforce to respond. Tackling climate change forms part of a key part of our strategic focus areas for the faculty for 2022 to 2025, and our climate and health strategy guides our programs of work in this area. Now, the Faculty of Public Health has become a credible and respected voice on the health impacts of climate change and environmental degradation, and we've worked in partnership with our members to ensure that the public health workforce has the knowledge, the skills, the capability to tackle these great threats to our health. And COP28 came at a time when we are already witnessing the impacts of climate change, both at home and abroad. And we know that without urgent action, there will be further avoidable increases in morbidity and mortality as a direct result of human activity. And that's why we're here today. Now, we know that no single actor can tackle the threat of climate change in isolation, and therefore partnership working must be at the very foundation of our climate and health strategy. Bringing together voices from across the system at events such as this is crucial for enhancing action on climate change. Together, working in partnership, we can share knowledge, we can stimulate debate, we can innovate new areas of practice, and we can deliver more impactful actions. So for today's session, we're going to open today's event with an overview and discussion of what happened at COP28. We'll be hearing from Lea Berrang Ford, who is the head of the UK Health Security Agency's Centre for Climate and Health Security, and Malik Amin Aslam Khan, a renowned climate change expert and Pakistan's Federal Minister for Climate Change from 2018 to 2022. Following presentations from Lea and Malik, there will be an opportunity to ask questions before I hand back the chair to Paul to introduce the next section of the meeting. I hope those of you joining us online and at our in-person hubs find the sessions both enjoyable and stimulating, and will leave feeling inspired and empowered to take forward further action to tackle climate change, biodiversity loss, and other issues threatening our planet and our health. So without further delay, I'd like to welcome Lea. Lea, welcome and thank you for joining us. We look forward to hearing from you.
Hi, Kevin. It's a real pleasure to be here. I don't have slides today. We just launched the UKHSA's Health Effects of Climate Change report this week, and I just got back from Dubai very recently. So no visuals for the moment, but what I would like to do is give some oral or some verbal reflections on the COP event and where we've been and where we are moving forward in the climate and health community. So as was mentioned, climate change is a grand challenge, but also a grand opportunity for health this century. The COP28, the Conference of the Parties, is a major annual climate summit, an event that's designed to bring together global nations to discuss and agree to a shared agenda to combat the risks of climate change. I attended COP6, I'm dating myself perhaps here, in 2000, which was in The Hague. And I've been to a number of COPs since then, over the past 2+ decades. And much has changed. And so I'd like to start off by reflecting upon some of those changes that I have seen over these past decades. For one, the health community was almost absent from the early COPs, which focused primarily on mitigation, decarbonization, and the health community was relatively slow compared to other communities in really sort of joining the global climate discourse and agenda. At the early COPs, climate was really seen as a future risk. It was still somewhat theoretical. It was very niche. And it was still largely unrecognized, at least formally unrecognized, denied, or ignored by a number of governments. So very marginal still at that time. Climate change was not broadly on the formal health agenda. So there was some early uptake, but this was more of a blip on the sidelines. And adaptation, or responding to and preparing for the real on the ground impacts of climate change, was in those days considered a distraction from the competing and perceived to be much more important interest in mitigation. So the idea at the time was that we don't want to talk about adapting to climate impacts because that will distract from or be an excuse not to mitigate and decarbonize. So adaptation, responding to the impacts of climate change, was seen as competitive with mitigation or decarbonization. And consideration of adaptation and preparing for impacts was considered almost sort of giving up on giving up on actually reducing or avoiding climate change at all. Fast forward 2 decades plus, and we have for the first time at a COP event at COP28 in Dubai, the first formal health day. This really is a signal of the importance of climate change for health, a long time coming. It's not the first time that health is on the climate agenda, nor the first time that health is on the COP agenda. What it is really raising the profile of health to have a formal recognition of health as a theme at the event and having a health day. So to many, this was considered still a tokenistic gesture. What does that mean? What's the implications of that? Well, being in Dubai, I met many national health ministers and other senior health figures from nations who were attending a COP event for the first time, and in many cases, a major climate event for the first time. Now, this included UKHSA's own Chief Executive, Jenny Harries, and Chief Scientific Officer, Isabel Oliver, who attended with me. And for them, it was also their first time at a COP event. So many of these individuals spent several days or a week immersed in the politics and the significance of climate change for their health portfolios, attending bilateral meetings with other countries, sharing lessons and insights, reinforcing commitments and collaborations. And the significance of this, I think, should not be underestimated. So there are many global health ministers who will be traveling home from COP with greater realization of the imperative and salience of climate change for their portfolios and for their priorities. And I think it's this less visible awareness and engagement with climate implications of health that will represent the greatest impact of COP28. And this goes really beyond the debate that dominates the media around success or failure of discussions on decarbonization, mitigation, fossil fuels, etc. I think what hides behind that is the significant value of having people come together and essentially, and this was a goal really of the UNFCCC process and COPs, that nations would get together annually, report, be transparent, meet, in a sense, ratchet up expectations and essentially peer pressure. And so I think that we really saw that in the context of health in Dubai. So what I'd like to do is flag 3 key areas or 3 key reflections coming out of COP. First, on what the climate will look like in the future, or what we're facing in terms of the public health community, how we should be preparing for what I'm calling public health 2.0, not only sort of the next generation of public health, but public health at 2 degrees above historic means. And then finally, what we're looking at when we think of professionalizing climate and health governance and practice. So those, I'd like to comment on those 3 areas. First, what are we looking at? What does the future look like in terms of warming with implications for public health? We're likely looking at about 2 to 3 degrees of warming this century. It's difficult to know exactly. It depends on global decarbonization trajectories. Depends a lot on what we do over the next 5, maybe up to 10 years. Global mobilization to decarbonize is ramping up. I think one of the things that was increasingly visible across the COPs over the decades is just how much climate and the imperative to decarbonize is going beyond niche advocacy, climate activists, and going into real salience of mainstream politics and the public in many countries. So there is ramping up of decarbonization. However, it looks at the moment unlikely that will be fast enough and sufficient to keep us below probably close to 2 degrees. So likely, and of course this is all guesswork, none of us have a crystal ball, likely we're looking at somewhere around 2 degrees, maybe up to 3 degrees. So what that means for health is that we will likely need to model and prepare for scenarios under which we progress from a 1.1 degree warming world, which is what we have now, to probably hitting 1.5 degrees of warming, probably by the end of this decade, which could be a major threshold, hitting 2 degrees, likely by mid-century, and then whether we hit 3 degrees in late century or we can start to decline over the next decades in the second half of the century is unclear. So really we need to be planning likely on that sort of trajectory. We should be aiming for lower. The less warming and the slower we can control warming, the better. And we should also be aware that we could be looking at overshoots up to 4 degrees. But I'm gonna go out there and say we're probably looking at 2 up to 3 degrees. That's my first point. My second, I'd like to talk about this idea of public health 2.0. So what does public health practice look like at 2 degrees above warming and transitioning? So climate change means that societies and countries are going to be decarbonizing. And that means public health will be transitioning likely from a place of primarily advocacy to professional integration, where climate change becomes something we want to move into business as usual integration into the professional work and practice that we do. So I see this movement where climate change is no longer sort of, or not for long, a niche area that we talk about on the side and as a side interest, but something where the community becomes increasingly savvy in understanding how climate intersects with health. And so I think this goes beyond decarbonization. And I think right now we have a community that is very, very interested, either climate change community interested in health aspects or health community interested in climate. But I think what we really need is to build professionalization, filling substantial knowledge and skills gaps. So we have professionals who really know the broad landscape of how climate and health intersect. And I want to flag five key areas where climate and health intersect. And I think we need to the largest extent possible, build our literacy in these areas. The first is the one that's probably best known, and that's that climate will impact health, and therefore decarbonization will be important in determining the level of warming and therefore the severity of impacts on health. So that's the more classic argument from public health community, often in the form of advocacy, that we need to decarbonize because climate change crisis is a health crisis. But I think that's not the only message. And so I think these other four messages are sort of lesser known as core places where climate and health intersect. The second is the contribution of the health sector itself to carbon emissions. For example, the NHS and Greener NHS has been a great leader there. So what is it about the work that we do specifically in the health sector that is contributing to emissions? The third is preparing for the inevitable impacts of adaptation. So regardless of how much we decarbonize and how much we push on that front, we need to prepare for probably at minimum 2 degrees of warming, up to 3 degrees of warming. And we need to prepare our health systems for the inevitable impacts of that. We're locked in. The warming up until about mid-century, we're pretty much locked into. The changes we make now will mostly determine what happens for trajectories of warming in the second half of this century. So over the next 25 years or so, we're almost guaranteed to see probably 1.5 to 2 degrees warming. So that's the third, preparing for the inevitable impacts through plans for adaptation. The fourth, taking advantage of the potential health benefits of decarbonization. So we need to be thinking very clearly about these transitions to a net zero world and what that means for health, and how we can align net zero goals across the economy with their implications for health. And I'll talk about that a little bit more in a minute. And then finally, I think this idea of loss and damage, which is climate vocabulary, is quite important, because there will be some impacts that we cannot avoid through decarbonization, that we cannot adapt to through preparation. There will be some leftover unavoidable impacts. And so we have to ensure that as much as possible, those impacts do not exacerbate existing inequalities. Now, this applies both within the UK and internationally. On the international stage, I anticipate we'll see increasing pressure on the UK in the area of loss and damage, which I think will be combined with pressure for post-colonial reconciliation, that the UK is among the countries that has released the most traditional emissions, and many of the countries, former colonial nations, are those that are suffering the most. And I think there will be increasing tension in this space in global geopolitics, within which the UK will need to face questions around loss and damage and colonial reconciliation, both historically and currently, in terms of its obligations to the global south. And I think in this space, there are substantial knowledge and skills gaps. And as we transition from sort of more of an advocacy interest role into professionalizing this space, I think filling in knowledge gaps on those 5 points will be really important. And what I'd like to see is actually building professional public health experts in climate change, and doing and providing more advanced training for those who really are interested in being highly skilled champions. My third point, I want to follow up a little bit more on this idea of public health during a transition to net zero. So the world and the UK will transform substantially as we decarbonize. So the UK has commitments to moving to net zero, as do many nations, and this will require significant changes across society. And it's not just climate impacts on health that I think we need to focus on. It's also the implications of decarbonization for health that may have even greater impacts in the UK. And that creates a lot of opportunities. For example, electrifying the energy sector in the UK has potential to have high impact and improvements for air quality and pollution-related mortality and morbidity. There's really great opportunities there. Transitions to active transport, so that's walking and cycling rather than being in a car, for example, which are part of trying to get people out of single-use vehicles. This doesn't apply to electric vehicles, are real win-wins for health. Movements towards lower carbon diets could also have really significant health implications. It's actually quite serendipitous that a lot of the things that are good for climate can also be good for health. Nature-based solutions, so this is greening landscapes. There's very strong evidence of improvements in air quality, reduced risk of flooding, improved mental health benefits. There are some potential trade-offs of greening or nature-based solutions, or rewilding, it's different words that are used. There's a risk of creating new vector-borne disease habitat. So it's not all benefits, there are some trade-offs as well. But nature-based solutions as well, if you can imagine the future of UK housing. How can we have a house that's energy efficient, has good ventilation, has good air quality? So what is the future of UK housing? Really what we want is to look at transformations that are ticking the box on affordability, improved health, and energy efficiency. However, many of these areas, these potential benefits for health on the pathway to net zero, lie outside of the remit of the health sector. And what this means is one of the key roles of the public health community is actually to find mechanisms to have a voice at the table of other sectors in land use policy, in transportation, in housing, etc. At UKHSA and the Center for Climate and Health Security, there are 8 mechanisms or 8 pathways of impact that we have identified. And what I'd like to do is share those with you as an example of the different pathways of impact that we might have as a public health community to speak to and contribute to transitioning towards net zero in a way that can benefit health. The first is engagement and partnerships, and this is really important for soft power, where sectors have a remit that is where we have no control or we have no remit in that sector, but they have huge influence on health. And so a good example of that is transportation. So engagement and partnership will be really important. Number 2, building the evidence base and case for action. So that's science, research, engagement with universities, and putting together a compelling evidence base. And I'll include within that an area that we're trying to develop, which is economic value for money cases to show the value of interventions and the cost of impacts. Number 3 is shared vision. It's consistently
Lea, I'm sorry,
yeah?
we have just another minute or so for your presentation, please. Another
No
minute.
problem, I'm finishing.
Thanks so much.
A shared vision, no problem. So what does good look like? Number 4, equipping people and institutions to act. So guidelines or toolkits, for example. Number 5, leveraging and improving data. So making data more accessible to those who need it. Number 6, monitoring and surveillance. In our case, this is particularly vector-borne disease. Number 7, increasing capacity and training. So how can we build governance capacity and skill sets to address these issues. And finally, bespoke emergency response and EPRR functions, specifically protecting health during extreme weather events. And so those are the 8 areas where we will be focusing our work on mechanisms to have impact. And I will end there. Thank you so much.
Lea, thank you so much for a brilliant overview and such a wonderful journey that you've taken us on, reflecting on how we've got to where we are now, reflecting on COP28 and the moment that we have with the greater engagement in health. But then more specifically, I think your challenge about what this means for public health practice in the here and now, and as we prepare for a 2-degree warming by the mid-century, I think really helped to focus our hearts and minds. So thank you so much for a really comprehensive overview. We're going to move straight then, colleagues, to hear from Malik Amin Aslam Khan, who will give his intervention for 15 minutes, and that will reserve about 15 minutes for questions and comments. In the meantime, if colleagues would like to put their questions in the question and answer function in Zoom, we'll be able to identify those questions and come to them as well. Malik, are you online? Can I invite you to come on board, please? Thank you, Lea.
Yes. Bismillah ar-Rahman ar-Rahim. Thanks, Kevin. And
wonderful.
If we look at the COP that just finished this morning, we're very well timed for this meeting today. I mean, this year, I will just go to the background of what was happening before the COP and what happened at the COP and how is it relevant for the public health area. You know, going into this COP, we heard the world ringing the scientific warnings very loudly. We had a report that came out that warned that the last decade, 2010 to 2020, was the hottest decade on record. So that means over 100,000 years, this was the hottest period that we had recorded in Earth. 2022, which was the last year, was also recorded as the hottest year over this whole period. So it was very clear that the climate change bells were ringing very strongly, calling it not just climate change, but a climate emergency. Then we had a report from UNEP, which does this stock take report of where we are on climate change every year. And that gave the stark warning that the 1.5 degree warming that we had all agreed to at Paris in 2015, we were going way above that. And what Professor Lea just mentioned, that the 3 degree warming was a reality that would be facing us later in the century. So all of these were very stark warnings to shake up the policymakers into doing something positive from this COP. On the other side, we had in the last year a number of effects of climate change that were being felt all over the world. We had flooding, especially urban flooding in New York, in Hong Kong, a lot of other cities where we had these rapid floods creating havoc. Then we had the wildfires that were burning in North America and all of Europe, which went on unabated, and this huge plume of smoke that engulfed a major part of humanity for a major part of the year was there. The heat that was being felt all across the world, especially in Pakistan, where I live, which had the hottest place on earth earlier in June. And there were certain zones which are already being classified as areas where life would not be possible in the very near future. All of this was being felt by humanity all over the world. So on one side, you had the scientists giving the big warnings, and then on the other side, you had the reality of climate change really hitting us starkly in the face. So with this sort of background, we had the politicians will go to COPs every year, but we had a fractured political environment, a very fractured political environment. We had coming on the heels of this Ukraine war and the atrocities in Gaza. The political environment was really not there at the start of the COP to start focusing on the issue of climate change. So, but when we got down into the COP meeting itself, we came out today with a mixed bag of sort of pluses and minuses, I would say. The pluses, I would just start off with the negatives first. I think the big elephant in the room was fossil fuels. It was there from day one. It was there till the last minute of the COP28. What are we going to do about the fossil fuels? Because it was clearly seen that we cannot get out of climate change. We cannot face up to climate change if we keep on going the route that we are, fueling our development with fossil fuels. And in just the last year, we saw, in spite of all the political commitments that have been made in previous COPs, we saw the fossil fuel investments actually go up by 10%. Another $1 trillion were spent on creating more fossil fuel plants all over the world. Renewables, although we've had a lot of talk about shifting this transformation to renewables, to this date, they are only 9% of the global energy mix. So it's a very low percentage still. But yet, this issue was there. And I remember I think it was the first day of the COP, all the island states got together, and I had the chance to be there at that time. And they were talking about a non-proliferation treaty on fossil fuels. So they were saying that, we are going to get together and we're going to create this new treaty, because climate change is not, the UNFCCC treaty is not delivering to us. We are drowning. We are countries which face an existential threat, and we need to get some other vehicle to help us deal with this problem. So there were 9 countries who actually signed up to that demand for a non-proliferation treaty on fossil fuels. So that was the level of urgency which was there with the issue of taking a U-turn on fossil fuels. So what happened at the end of the day was that we had this big debate in the last 4 days whether we're going to use the word phase out or we're going to phase down. And finally, what they agreed on was the wording of transitioning away from fossil fuels. Now, that can be seen from both the angles, from a positive angle and a negative angle. The positive angle is that the fossil fuels were really not being debated till Glasgow COP26, which was 2 years back. The word fossil fuels was never a part of the climate negotiation, the official text. It is only 2 years since this issue was brought to the table officially, with all the opposition that there is and the interest groups that there are. And so I think after having been there for only 2 years, now we have a commitment from all the countries. It's not a solid sort of commitment with penalties, but it's a soft commitment. But it is actually a soft agreement. But all the countries of the world have signed up to it, saying that we are going to transition away from fossil fuels. So that's, I think, the positive side of it. How and when that is going to happen, and that's something which we are going to be debating over the next few years. So I think that was that this negativity on fossil fuels was also fueled at the initial part of the COP by the fact that this COP itself was happening in a country which is really at the heart of the fossil fuel industry. The UAE and the per capita emissions are one of the highest in the world. It's a consumptionist economy. The head of the COP28 this year was also the head of the largest fossil fuel group in the UAE. So there was this big debate about whether there's a conflict of interest or not, and so there was a lot of negativity going into the COP. So I feel what we've achieved today from the COP document is actually quite a remarkable achievement. On the plus side, I would say that on the very first day of the COP meeting, what Professor Lea just mentioned, the loss and damage fund. Now that's a fund which is extremely important for countries like my own in Pakistan, which is one of the most affected countries of climate change. We have been on the top 10 list of most vulnerable countries for the last 10 years. So we're a continuously impacted country. We are only 1% of the global greenhouse gas emissions. So, this is a fund which is going to help countries like ours when they deal with climate change, which is not of their own making, but which they are facing the brunt of. I mean, the last year, the climate change bill to Pakistan was about $30 billion, $30 billion. In a country where we hard stress for cash, and we were a debt-ridden country, but yet we were put on this bill of $30 billion for no fault of ours. We're not a big emitter. So for countries like us, this fund was very important, and it got agreed on the very first day, the operationalization of this fund, and there were about $700 million that was committed to this fund also. So that's a positive thing, which I think as we move forward is going to help us. The other positive was that this year we saw a lot of private sector activity on the sidelines of the main negotiations. In the main negotiation rooms, you only have the ministers and the official delegations participate. But what we saw on the sidelines happening, there were over 100,000 people present at the COP who had registered officially. And there was a blue zone and a green zone. The blue zone was mostly for the government officials, but the green zone was full of private sector individuals. So the signal of climate change was very much present. Everybody in that arena, and all the big names were there, realized that we are looking at a carbon constrained world in the future. And I think the Glasgow COP, which happened in 2 years back, really created that momentum by focusing on this net zero figure that countries were agreeing to. Because of this net zero figure being there, a lot of companies realized that in the future, they're going to be facing a world where carbon emissions are going to be constrained. So if they have carbon emissions of their own, they need to do something about it. There were funds which were being announced by the private sector. A lot of innovation from the private sector was also prevalent in the decarbonization economies. A lot of young people were there with their own ideas, trying to push forward this new world where the carbon would be constrained, and how we're going to do it, renewables, electric vehicles, investing in nature. All of these were present in the green zone. And that was a very heartening thing that, we could see this mass of humanity actually trying to address the problem through innovation and through private sector financing. It was a big positive as far as I could see it. And then the third positive, which is directly linked with why we are here, the Faculty of Public Health, was that this was the first COP where the nexus between climate change and health got officially accepted. It got officially accepted, and it was the first time that there was a full day which was focused on climate change and health and the debate that goes around it. And it was it had hundreds of events taking place where everybody was discussing how climate change and health are clearly intertwined, and what are we going to do about this in the future. So I think this was a big win for the health professionals, that this nexus got accepted in the official climate change debate. And one of the reasons for this was actually COVID. The COVID crisis is the crisis which woke up the world, which shook the world, and made it realize that when you try and ignore the issue of preventive health, what that can lead to, and it really shook up the world, and also waking up to the fact that when you delay action, once you realize that there is a problem, what does that lead to also? But it also brought the world together by making them understand that if there is collective action to a collective problem, there is always a solution that can be made. So I think the COVID year was very important in bringing this health agenda linked up with the climate change agenda. And then I think on the very second day, there was this big declaration which was signed on climate change and health. It was a declaration which was developed through the WHO. They have a group called the ATAC, which is the Alliance for Transformative Action on Climate and Health. And this group had actually worked on this, and we had this declaration which came up, and more than 130 countries have signed up to it. So that's a very strong affirmation of not only the nexus, but also of what we need to do in the years ahead, and that has a direct bearing on all the health professionals like yourselves in the Faculty of Public Health. Now, this declaration is actually a blueprint of what the global world countries have agreed to. It provides a recognition of the magnitude of the challenge going ahead. It creates a number of nexuses. The big nexus was between climate change and poverty and health. That all three are linked together, and you cannot dissociate one from the other. And it's built basically on three pillars. And the three pillars are number one, that we have to focus on the direct health impacts. Climate change and a heating world has direct health impacts when it comes to vector-borne diseases, such as we have malaria, malnutrition, diarrhea, heat stress. There was a figure that was being floated that the heat stress deaths in just 1 year have risen by over 60%. And we again in Pakistan realized that the incidence of malaria in the area which was hit by the floods, the incidence of malaria went up by 400% just in 1 year. So these direct impacts are very important. The second pillar is that countries need to be building the capacity and having the policies which address this nexus between climate change and health. And the third one was that we have to enhance the resilience of people and the planet if we are to address this nexus between climate change and health. And linked with this resilience aspect was the issue of which was focused on was called the One Health approach, which states that the three human health, the animal health, and the health of the ecosystem, they're all linked together. And when we talk about climate change, we are focusing on the ecosystem health or the health of the nature around us. Unless that is a healthy environment, we'll have problems with human health and also with animal health. And the COVID was a zoonotic disease that happened. So this was the basis which really created the platform for this nexus. And finally, when we look into the future, what are the 3 or 2 things that are most important when we're talking about this nexus between climate and health? The first one is that there is still a lot of work to be done. Again, we heard Professor Lea talked about a lot of issues that need to be focused on, creating the basis, the scientific evidence basis, which can trigger actual action. We need to create the skills that need to be developed for this new world, which is going to be a carbon-constrained world, and where this issue is going to be one of the important issues. I just got off CNN and I was watching that. The skills gap on climate change is huge. For every job on climate change, there's only 1 in 8 person who's actually employable for that. So new skills will have to be developed. So number
Malik,
2,
Malik,
I'm just finishing off. Thanks.
You have 1 minute
last
left. Thank you.
Okay.
Yeah.
The second one is financing. There were a number of announcements made. About $1 billion was announced by various countries, by the Bill and Melinda Gates Foundation. These funds have been announced, and they will be focusing on looking at opportunities along the climate and health nexus. And the last one is that we need to look at the reforms of the insurance system, because when you talk about climate change and health, we are talking also about the health insurance system, which will need to factor in climate risk for the future and work on that. So with this, I would like to end, and I would just like to say that the one big takeaway from this whole COP was that climate change is also a health crisis. So it's not just a crisis of nature, it's also a health crisis. And I think that's something that opens a lot of opportunities and doors as it clearly creates a pathway towards a new world that we all have to face together. Thank you.
Wonderful. Malik, thank you so much for an excellent overview. And it was really good to go into a bit more depth in terms of some of the reflections on the importance of this COP for climate and health, and your reading of the granularity of what's been agreed and where we have reason for hope but also reason for challenge as well. So we have Malik and Lea, just a few questions for the next 10 minutes or so coming from the audience. I'm going to ask for brief responses to each so we can get in as many questions as we can. So Malik, I'm going to start with you. You mentioned that there were several loopholes in the transition away from former fossil fuels. I wondered if you could shed some light on what some of those loopholes are.
Well, the loopholes are in the agreement itself. It calls for a transitioning away from fossil fuels in a just and equitable manner. Now, what you mean by just and equitable is still debatable. The loopholes are also in the fact that within the agreement, they've also talked about people who are in the fossil fuel world to offset those emissions by looking at carbon capture, by looking at carbon sequestration. So, doing things, not changing your own pathway, but to do things which can offset those emissions. I think we need to do more than that. I mean, I feel that the climate change has to take if we are to survive climate change, we have to take a big U-turn, and the U-turn has to be on fossil fuels. That U-turn is still not there, but we have these signals now coming out. As I said, the COP26 in Glasgow was big because they gave the signal for a net zero world, and that's why the private sector is all out there, because they see it as a risk to their business if they don't go this pathway. Similarly, I think this COP will have given that signal that that we had to get out of fossil fuels. When and how needs to be worked out, but it's still, I think it's a strong signal, but we will be debating a lot of these loopholes as we go forward.
Wonderful. Thank you, Malik. The second question, Lea, goes to you. And I think colleagues were really taken by the 8 pathways that you mentioned towards the end of your presentation. The question for you is that fossil fuel phase out is critical for keeping warming low, but COP28 says that transition away from fossil fuels, which is perhaps not seen as being strong enough. What do you see as the public health role in respect to this in terms of either greater advocacy or helping to move this commitment forward?
Yeah, really great question. I think there are different pathways. There are different shades of green. So it might be that you prefer advocacy as a pathway. It might be that you or your institution prefers building the evidence base for the cost of the impacts of climate change or the benefits for health of decarbonization. I think just having a glance, I think those are sort of probably the big mechanisms in terms of a theory of change to push on the mitigation side. In a sense, all of these mechanisms can be ways to push towards providing a case for decarbonization at the COP. Yeah, really probably what's needed is action across all sectors and all mechanisms, but those first two are probably the main ones that come to mind.
The main ones. And just staying with you, Lea, I was also taken by the Public Health 2.0 framework that you shared with us. Many of those actions felt as if they were operating at the national and global level, but many of our colleagues are going to be with us from local government, working in local communities. And I wondered, are there priority actions that we should be asking at local level, which either builds on your Public Health 2.0 framework or adapts it for local action?
Yeah, really good question. So in Public Health 2.0, I talked about very much, those are, I think that that's more of a knowledge and training list. So being aware of the different ways that climate and health intersect, that it's not just being aware of impacts and worrying about decarbonization, it's preparing for those impacts and looking at opportunities to benefit from pathways to net zero. One of the things that we're doing at the national level is working on development of provision of products and services that can help local partners, guidelines and toolkits to assess risks, to identify intervention options. one of the sort of most immediate things that comes to mind is really looking for building capacity and knowledge within existing staff, so you can have champions and staff that have training to be able to access and begin to integrate these factors, to sort of see where are the entry points within the work that you're already doing. One of the things we did is we've created a mobilization team, and their job, this is led by Carolyn Tomes, who comes from local public health authority in Bradford, whose job it is specifically to work with local public health authorities to translate, to find out what local public health authorities need from us or how we can be helpful, and for us to be able to share back some of the tools and guidance. So I think that reciprocal relationship is something we've just really taken a step change in catalyzing.
Excellent, thank you. And if I might add my own reflection, working at the regional and local level, that one of the assets that we have as public health practitioners locally is our connection to local communities. And so the ways in which we are able to leverage our assets to engage and educate local communities, to really think about vulnerable populations, and to leverage the ways in which we're working our programs to help this agenda, that should really be part of our capacities, I think, in Public Health 2.0 as well. So community engagement, mobilization, and asset-based responses to climate change. And a key part of this, Malik, is tackling myths and misinformation as well. So this is a question for you from another member of the audience, which is, how do we challenge misinformation effectively, consistently, proactively, and responsively? Because we've seen where different truths or existence in a post-truth world can make it difficult to cut through and to change behaviors, change public opinion, and even change policymakers. Any reflections on what we might do in an environment where there's so much information and misinformation? How do we cut through, and how do we ensure that we're taking people with us? Malik, first.
I mean, this is not an easy question to answer, because this is the age of falsehood. Just looking at the climate change arena, actually climate denial has become a real populist agenda. If you look at populist leaders, in the US, in Brazil, Bolsonaro, in Argentina, in Netherlands recently, they've been tagging on this climate denial aspect. But yet, I think what gives credence to the truth is that if you have proper database scientific evidence, and that can come from forums such as yourself, which is on public health. We have the IPCC in the climate change arena, which is more than 3,000 scientists who sit together, and then when they come out with a combined non-controversial statement that has truth attached to it. Similarly, on the health side, I mentioned this body which has been created, which is called the Alliance for Transformative Action on Climate and Health. It works under the WHO. Again, it's experts who talk about certain things, and it is data-based scientific evidence. The Lancet Countdown, which is again a health journal, which gives a yearly sort of statistical facts on climate and health nexus, is again what people take as truth. But then you have the social media world out there. Anybody can post anything and get away with it. So we have to living in this age of falsehood is not easy.
So I think that's going to be part of our ongoing conversations about communication, engagement, education, and bringing communities along with us, and the unique roles that public health practitioners play as being trusted voices in this space. So Malik, thank you so much for your presentation today. Lea, thank you for your presentation as well. It's been really wonderful to start this session by getting your reflections on COP28, but also the agenda that should shape our practice moving forward. So colleagues, with that, I'm going to hand over the chairing now to my colleague, Paul Johnston. Paul, over to you.
Thank you.
Thank you very much, Kevin, and thank you, Lea and Malik as well. Good to see you again. And what a great start in setting the context to this next part of our conference, which is an opportunity for you to reflect and to comment and to question. We're going to go into breakout rooms in a minute, and I'm hoping, Davina, you'll be posting the, there we are, we've got a link to the Padlet, which we'd like you in your groups to use, please. If you can use that for reflections, comments on what you've heard, but also we have 3 questions which will help generate a discussion as well. They are on the Padlet, but I'll just say what they are here. The first is, what are the main public health messages and actions for you? How can the faculty support that action? And do you have any outstanding questions? So it's really an opportunity for reflections, but also how do we continue to shape our professional body, the faculty, in influencing and guiding and taking forward this whole agenda. So what then I would like to say also is that can one person in each breakout room take on responsibility? If you can allocate yourself one person at the start who will record some key points and upload those onto the Padlet. What we'll do is Davina and colleagues and the facilitators will summarize those for the Q&A session right at the end of today's conference as well. So do please use the Padlet to generate so we can use that information. So we've got 20 minutes now, and we'll give a reminder just before the 20 minutes is up, 2:20. We're bang on time. We'll have a short break then, and then we'll restart with the panel and then answers to and discussions around your questions and points you make. So without further ado, hopefully Davina and someone will press the button and we'll go into our breakout rooms. Thank you. Okay, I think I make it nearly after 2:35. I hope you had a good tea break. Welcome back. We now enter the next part of today, which is a panel discussion. And we're going to then have an opportunity for questions and answers. But for the next 20 minutes, I'm delighted to welcome our panel. I'm going to introduce you and say one interesting thing about you, and then I will ask you questions and open up for your reflections on today. Davina, can you just put a thumbs up if this is coming across okay to you? Can you see me all right?
Yes, we can, Paul. Yeah.
Brilliant. Okay, thank you. Excellent. So we've got a panel of 5 speakers. So I'm going to introduce each now. So Kirsten Bash, if you could put your camera on as well, Kirsten, so we could see you. That would be great. So Kristen Bash. Kristen is a public health consultant who actually attended COP and has a long-term interest in food and health. Then we have Abdul Razak, who is Director of Public Health at Blackburn with Darwin Council, and he represents the local government sector. He's previously been a DPH in Suffolk and Trafford, and I know works extensively with the NGO sector. So welcome, Abdul. Then Anya, many of you will know Anya Gobford, who is a public health registrar, but she chairs the Specialist Interest Group for Sustainable Development, and she's currently on a placement with FCDO advising on climate and health investment. So a really, really key, important role there for Anya. Next we have Rebecca Matthews, who's a consultant in public health at Public Health Wales. She leads on climate and health for Wales, and she needs to leave at 3 o'clock. So we need to be mindful of that. And finally, Rebecca McEwen. Rebecca is a medical student at Aberdeen, and she's shown a huge amount of leadership on planetary health, on the planetary health report card for the UK, amongst many other things as well. So welcome, Rebecca, and welcome to all 5 of you. So I'm going to kick off by asking you, each of you, if you'd give us your take-home message on COP28, and particularly how it applies to you and your organization where you are at the moment. So I'm going to go in that order of my introduction. So Kristen, can I hand to you first, please?
Hello, yes, thank you. I was able to attend COP in person this year. I was an official observer on behalf of the University of Sheffield and Grantham Centre for Sustainable Futures. And if you've not, many of you have probably been to COP. If you've not been, it was my first time, and I can say it was overwhelming, right? In the best possible sense. First of all, it's huge. There are 6 different events you want to go to at any one point in time, right? So there's a lot going on, and it's all about climate change. So that itself is also overwhelming. So as much as we take this on board in our day-to-day professional lives, we think we do, when you're going to one meeting directly after another, talking all about this issue, that itself becomes quite overwhelming, right? But in a good way, because what that overwhelming feeling does is it really energizes you. And the other thing that's overwhelming is how much enthusiasm, passion, and just dedication to working on this issue is all around you with so many people in one place. That was tremendous. So of course it was historic and it was inspiring. It was the first day on health, the health declaration. It was also the first day on sustainable agriculture and the agriculture declaration that was signed by over 150 heads of state, which was truly inspirational and very moving. It was also a bit disconcerting at times when you sit through an informal meeting and 20 minutes out of 60 minutes of the final meeting meant to resolve an issue, 20 minutes of that is spent talking about the difference and whether the use of the word agree or decide should be put into the language, and no one can figure out which one of those 2 words it is. So with all of that, and in my final 20 seconds, what I'm bringing back with me, I hope, and 2 minutes isn't enough to wrap up the situation, but I hope to bring back that enthusiasm, the ideas that I saw. There were so many inspiring case studies, inspiring initiatives, bringing those back to my work as chair of both the Food Special Interest Group at the faculty, and I chair another food network, and also into my work at the university. And if international work is going to move slowly, we need to move at pace. And so that's what I'm taking away. So thank you.
Thank you very much. Yeah, thank you very much, Kristen. Really good to hear from you, particularly as you come hot from the conference and giving us that take, and also the fact that health is in other sectors such as agriculture, and that's an important point to make. So thank you. I'm going to move without further ado to Abdul now. Abdul, can you give us your reflections on how you're going to take this home to your work in the council?
Thanks very much, really, Paul. Good afternoon, colleagues. Hope everyone can actually hear me. Great to be with you. So basically, within local government, really, clearly COP28, really, in terms of some landmark decisions regarding fossil fuel and around home, about energy efficiency. I think in some of our local authorities across the Northwest and across England, really, we've been really raising the flag really for climate change for some and health kind of impacts really for some time. Clearly, we're seeing some of those impacts into the severe weather events, really, whether that be heat events or whether that be flooding, localized flooding, which causes resilience issues really for local communities. So really, adaptation really has to be part of the key, really. But it's great to see really that there is clearly some level of movement really on those issues in relation to the bigger picture. In terms of what local authorities and organisations are actually doing around climate change, clearly recognising it as a mainstream issue is one. Clearly, declaring within my local authority a climate emergency. We've had a climate change panel with local residents in terms of citizens and panel jury. So we're involving our local residents in terms of actually shaping the future and having conversations. So the more conversations, the more momentum we actually build around this agenda, then the more resilient our communities may actually then become. But then in terms of adaptation, there's lots really that we could do around levelling up. So any capital and non-capital expenditure, really, we have climate as part of our decision-making process within our statutory organisations. But my final point really clearly is that there's a lot that we can do around levelling up and using some of those monies as they come on stream to adapt to make some of those adaptations in terms of infrastructure, because money is tight really within the public and private sectors currently as we speak. So I'll pause there, Paul, and hand back to you. Thank you.
Thanks very much, Abdul. Yeah, and I'd particularly like to come back to working with the private sector as one of the questions that came up. But thanks for that insight, Abdul. Much appreciated. So can I move then to Anya? Anya, can you give us a view on COP and how you're going to take this back, particularly in FCDO, perhaps?
Sure, thanks very much, Paul. To give you a couple of the kind of headlines from the health work at COP in a bit more detail than we've heard already today. So you know that there was the first Health Day and the Climate and Health Ministerial Declaration got mentioned earlier, but that was really monumental in the sense that there were 120 health ministers at COP for the first time. So that's really demonstrating the commitment of countries to the climate and health agenda specifically, and also the health ministers being present at COP, really giving them an opportunity to actually appreciate what this means for health more broadly. Over 140 countries have signed on to the declaration. And the other thing that was quite substantial at COP with regards to climate and health specifically was the funding that got announced. So $1 billion of climate and health funding got announced in total at COP, roughly. Of that, 100 million is by Rockefeller, so that's for global health funding in the climate and health space. But as governments go, the UK government was the only country to pledge climate and health specific funding. So whilst 40 million doesn't sound like a huge amount for the whole world, it is the only UK government to have done so. And what that really tells us and what that means for us back home and in the UK and in public health is that where we have the opportunity to influence our government, and therefore we can get our government demonstrating in some areas at least that they are leading, that is setting the bar for other countries to come along to. So it whilst more broadly on kind of domestic climate commitments, the UK government might not be quite where we'd like it to be with regards to health. It really is demonstrating leadership, and that is something for us to both celebrate and then continue to push for more. It wouldn't be fair to say that. I think one of the priorities moving forwards is how do we make sure that we can get our government into a position that it is continued to be viewed as credible on climate in general, so that the work that we can do on health and push on health can be really fully taken on board by others, because otherwise there's an opportunity for them to discredit what we're saying on health in comparison to other areas. So from an FCDO perspective on the health area specifically, it was a very successful COP, and there's a lot to build on moving into COP29 and specifically COP30 in Brazil, who've very much agreed to take on the climate and health mantle for their COP presidency in 2025. So that's kind of my key takeaways for now. Paul, I'll hand back to you.
Yeah, thank you very much, Anya. And indeed, we now know where the next two COPs are, because next year is in Azerbaijan, and as Anya said, the year after is in Brazil. And I think one of the things we reflected on last year was actually this COP is not just an annual event, but we need to keep it alive through the year as well. So and make sure messages don't get missed. So great, thanks very much, Anya. Can I then move to Rebecca, please? Rebecca, I'd be very interested to hear more about the work in Wales and how this will influence your work. And you're absolutely right. You need to go at 3, but it's not the most important thing. You're right on that. Thank you, Rebecca. Over to you.
Sorry, I was making a glib comment as per usual. Thank you very much. And I think one of the joys of this work that we've been able to demonstrate through the SIG is actually how you bring a coalition of public health practitioners across the public health system within the UK to really focus around one key agenda. And it's really thanks to the faculty for bringing this together. I think it's been a great way of working. I think there's 4 main areas really kind of to take home for Wales. One is really that it requires a local, national and an international response to this work. And we've all talked about that previously, but that can look differently at different levels. And what that means for us in Wales is earlier this year, we published the health impact assessment around climate change within Wales, which provides a framework for how we can understand the health impacts that exist. What does that look like on a national level, and how does that follow through then down to local action? And we're using that within Wales really to work with our local communities, We have I don't know if you still have health and wellbeing boards within England. It's been a while since I practiced there, but we certainly have local partnership boards where everybody comes together, and those are just working through climate adaptation plans at the moment. And so we're using that health impact assessment to really focus down on that local action. So it's taking national policy making work and really working through how we put that into practice within those communities. Something that Abdul mentioned around flooding and resilience in those communities, we know that that's a key issue for us in Wales. We have some key communities that flood year on year on year. That's only going to get worse. And there's a real challenge for us in terms of how we provide a mental health response to that crisis. And it also changes how we work outside of the traditional realms of public health practice, so working more with the insurance industry, because we know that if people can be informed of a flood in advance and they have time to respond to that and move their belongings out of the way, but also be able to insure their homes the next time, that makes a huge difference to people's mental health. So it's not just looking at what we can do from a health service provision, it's how we can influence policy, the way that insurance is delivered within our community, so that people can feel confident to stay within those communities and the relationships that they have and lead long and prosperous lives within those communities. And it really comes back to what Muir Gray said quite a long time ago now around the importance of covert operations. So we know that there's been challenges in relation to lobbying and how lobbying potentially can influence the rhetoric that comes out of not just COP but other arenas. And you only have to look back to our experience of working within public health around tobacco control and smoking cessation to know that the importance that the lobbying group and the lobbying industry, who are far more financed than we are within public health, to be able to make inroads into that space. And actually the importance of covert operations and working quietly behind the scenes with players that are outside traditional realms of public health practice can really show benefits to how we can start to work collectively around key challenges. And it brings me back to the final point around public health being a diverse community. So we have different levers. You know, I work for the NHS, so I'm not bound by the Civil Service Code, as are other colleagues. So I have different levers than others will in this system. And we also have the four nations within the United Kingdom operate and are governed differently because health is a devolved function. But actually how we can work collectively across those boundaries is really, really important. And we'll have the greatest benefit by doing so.
Great, thank you very much, Rebecca, and I'm really interested to hear that. I mean, Wales has been a forefront of many areas on climate and health as well. I mean, and I was also struck by the road scheme, the road speed scheme as well. And we've, you know, as a faculty, we've also worked on the consultations in Wales as well. So it's been a real privilege to help you with that. So thank you very much, Rebecca. And then I'm now going to go to our final panelist is Rebecca McEwen, who's a medical student from Aberdeen. And Rebecca, over to you for your reflections, please.
Yeah, so as a medical student, for me, I took a lot from having the first ever health day at COP this year. I felt like there were so many different events that could be learned a lot from. I'm also the Plant Health Report Card UK co-lead, which looks at sustainability in different areas of medical schools, such as curriculum and research. And this is in healthcare institutions around the world. And from these scorings, you can see kind of that the UK is quite a long way to go in a lot of medical schools in educating students on sustainability. We really need to educate our future clinicians on the climate impacts of healthcare and the impacts the climate change will have on like our patient populations. So then, because these are the future doctors, these people who need to understand these impacts so they can try and mitigate the outcomes, and then they can make sure these impacts are reduced. And they need to understand things like the impacts of air pollution and heat waves on patient populations. And I think what I really learned was there's just a huge amount of areas that need to be taught to students that's not being taught currently. And there's a lot of people just don't think it's not really going to affect our patient population as we're kind of like a protected country, but it really is. And we just had a really quite a bad flood up near Aberdeen and Brecon. And as the other Rebecca spoke about, understanding the mental health and physical impacts of this kind of thing is so important, as this can be beneficial to our healthcare, but understanding the impacts it'll have on our patients. So yeah, it's really important just to understand the future impacts. And I also think something that's important in Aberdeen, as a student in the oil capital of Europe, it's important for medical students and staff to think about the possible effects that phasing away could have on the city and its population, like would it increase poverty levels in the city? So I think there's quite a few things to consider.
Great, Thank you very much, Rebecca. So I want to go straight into one of the most important questions that's come up from our audience, which is around, if you like, a little bit of frustration around the final declaration and announcements around fossil fuel. And I'd like to ask particularly Kristen and Rebecca McKeown, whether you were there. What do you think about, did this go far enough? Are there loopholes? What's the perspective from the arguments against it? And in particular, was it just the lobbyists from the commercial sector? Was it other countries? Is there something we can understand more about this really critical element of the COP declaration on fossil fuels? So if I go to Kristen first, can you give us a view?
That's a big question, Paul, and not having insight to all of the discussions. I think from my perspective, I think it's remarkable, first of all, that fossil fuels hasn't made it into the final wording of any COP agreement until now. And that's a huge win. And there's no other way to say that. That's definitely a, it should have happened a long time ago. It's happened now, so we can tick that box. Should we have gone further? I think most of us on this call would say that the phase out of fossil fuels is something that should be there. Dr. Tedros talked about that. It's something that we're looking for as public health, generally speaking. But watching the meetings go on in a room and having people, 200 people decide on anything, as I said before, on a word between agree and decide, having to agree on something that big. I'm an optimist but I'm also a pragmatist. And so is this an incremental step in the right direction? Now, whether the lobbyists have been there from the beginning. So I don't know that they've had more or less influence in this one. That's something I'm not privy to, but I would think they had as much influence as maybe they ever had. And we have pushed it slightly, which is a win. And a good compromise is where everybody's slightly unhappy, is something else I've learned. So possibly that's, baked into compromising and agreeing something across the board. So that's my view. Not happy. Yeah. It's better than nothing.
Yeah, no, thank you, Kristen. That's great. And Rebecca, if I can just come to you as well for a quick reflection. Got other questions coming up as well. So that's Rebecca McKeown, yeah.
So a thing I found was just the lack of kind of understanding of the impact it's going to have in Pacific nations. I felt that they had that discussion all night, and then there was a bit of it wasn't really discussed how it was going to impact a lot of nations. I think one person said it was like they were putting their boat into the water, but there was holes in the boat because they were going to be so badly impacted by what's happening. I think it definitely should have gone further, but at the same time, it's so challenging to know because so many countries have already benefited from fossil fuels in so many ways, and taking it away and blaming other countries like India for their use of coal when they're still trying to develop as a country is quite a challenging thing to do. And managing those the differences of how countries are benefiting is quite challenging.
Yeah. Okay. Thanks very much. So I'll quickly ask the other Rebecca before you go. We're really interested to hear about the work you're doing in Wales. And you mentioned about working with the private sector and the challenges around that, drawing on tobacco in particular and comments from Neil Gray and so on. I mean, what messages would you give the faculty in this space about tackling perhaps some of the hardest challenging parts in terms of working with working with or working against the commercial sector? And have you got any insights from Wales on how you go about doing that?
I wish I did, but what I do have insight into is how effective it can be when it's done properly. So if we look at kind of the general return on investment that you get from public health type interventions, we know that kind of that legislative space where you have national policies or national legislation that covers a whole country or an international agreement can really have the greatest return and benefits financially. And so focusing our time and energy more into that space can, I think, have real payoffs for us. And we have I'm very fortunate to work for an organisation that has, we are a WHO collaboration centre on investment in health and wellbeing within Public Health Wales, which is where I work. And lots of the discussions that we have in that kind of international space is how we do more working collaboratively in that space internationally with the private sector, and how we can start to build on those experiences and really start to speak the language really that others listen to, and how can we factor that more into our communications around population health and how to make improvements?
That's great, thank you. I just wonder, while there are other reflections on this question, I'm thinking, Abdul, as a DPH, you'll have some businesses in your area, some of which might depend on or promote or use fossil fuel, I'm sure. So any views and to sort of complement what Rebecca's just said?
Yeah, thanks, Paul. One of our biggest kind of polluters really is our local NHS. It's about 20% really of all carbon emissions across our footprint. So therefore, decarbonising our NHS really seems to be one of the, in terms of the public sector, seems to be one of the main drivers in terms of what the NHS can actually do. And there's lots of work in that green space and sustainability kind of agenda. The other aspect clearly is very much about hydrogen, and where does hydrogen actually sit really within this whole debate really in relation to fossil fuels really, and obviously the energy mix of the future. From a local authority perspective, together with working with businesses, locally we are having those conversations really around, basically, creating the architecture and the infrastructure for electric vehicles, a hydrogen mix really within commercial vehicles going forward as well as part of the process. But it's very much a slow kind of conversation really in terms of that transition. But the conversation is actually beginning to actually then happen in terms of our levelling up agenda really, and most importantly really, it is part of some essential conversations around devolution from a political perspective really, in terms of the political sphere of the transport authority, highways, and so on and so forth really, skills as well really around how people would actually commute within a hybrid working environment really to or from what does work actually then mean in terms of climate and health. But ultimately, one final point really around, we've talked about health and well-being from from different perspectives really, but mental health actually being one. Resilience of communities and left behind communities, or those really who are least likely to actually benefit from those. I think there still has to be some level of focus on those communities who will still not be part of the mainstream in terms of some of these new technologies as going forward, and clearly therefore the inequalities gap may actually be further exacerbated. So we might actually then have populations which can actually adapt to changes, technologies, AI, and a whole range of other climate change kind of adaptations going forward over the next few decades. But those with the least opportunities really may still actually then not be afforded those resilient opportunities, and therefore, how do we address those really with those communities as part of the cost of living challenges, as well as the poverty challenge, will still remain for public health professionals going forward.
Yeah, thanks. I'm going to come back to communities. I think working with communities is going to be a key part of this whole agenda, isn't it? And it's certainly coming up in the questions. Before I do though, can I just go to Kristen as a consultant working in Yorkshire? What are your views on working with the private sector in particular, and and any messages you've got for the faculty?
I wish I had some very keen insight here. I don't work with the private sector very often. However, in my work at national level and with Eating Better and looking at sort of meat reduction and food systems, I've sat around the table with retailers and farmers and animal rights and climate. And understanding all of the different perspectives, first of all, is essential to having a meaningful discussion with any one of the parts of the system. These are systems issues. And if you ignore one part of the system, you're ignoring part of the solution. So bringing everything together is a really, it's important. It's also important to be extraordinarily transparent in these things so that you are everyone knows where that interaction takes place, the level that it takes place, and the influence, for example, that it may or may not have. Because I think once you start getting into worrying about that type of untoward influence, as you brought up in the earlier question of the lobbyists and the influence on the fossil fuels and the discussions, you just need to be very transparent about these things so that we know what's going on. But including industry, and this goes for just about anything, I think is important at some level, because they need to be part of the solution, you know, in one way or another. And so engaging them to the extent they'll engage, I think, is important, is my view.
Thank you, Kristen. While we've got you on the mic, can we just explore a little bit about the food systems deal and the agriculture deal as well? I think food is seen as something that's going up very much in our awareness of this, of all the climate issues around food, agriculture, and so on. Would you just give us a quick sort of thumbnail sketch on what happened in COP and what happened in those agreements and declaration?
Yeah, so it was building on the work from Sharm el-Sheikh on the, what I heard is the second longest name of any working group ever in COP, which was the Sharm el-Sheikh implementation work on agriculture and climate something. And that was the discussion where they couldn't decide between words. There was a sidebar around coordination groups, and certain countries didn't want to create coordination groups. So from someone who was new to the discussions, they seemed like trivial points. To the people involved, they were very important points, but that work did not move forward. And what that means is, while we were quite encouraged last year by there being language and work to take forward on agriculture and food security, this year it's stalled and it will not be picked up again until June of next year. So that's that piece of it. Now, when you look at the global stock take, the adaptation does make reference to sustainable food systems, or rather they talk about sustainable agriculture and resilience. So that's good that it's made its way into the adaptation section. It did not make its way into the mitigation section. And so I'm sure many people on this call know that agriculture has a circular relationship with the climate, and that it's creating climate pressures, and it's also a victim of climate pressures, to put it in very simple terms. So looking at the adaptation side, of course, is important when we start talking about food security and, you know, low-income countries in the global south, extraordinarily important, and particularly when you talk about financing and the very low percentage that those countries have in financing to adapt to those things. However, ideally, and hopefully in next COP, we will be pulling that wider and looking at mitigation and really, you know, particularly when you're talking about, you know, methane and carbon and reducing all of those things. And then the final thing is how much talk in the health day had to do with food and agriculture, and how much talk on the agriculture day had to do with health. So the two are so inextricably linked that having them a week apart, they're separate, but they're together. And so I think finding those links between all of the various areas, and that's really where I work in that nexus. And so to me, it's very apparent, and it's encouraging that it's becoming more apparent in the wider discussion. But you cannot have climate, you cannot solve the climate issue without solving the agriculture issue. It's that simple. So yes, hopefully.
Yeah, thank you. Thanks, Kirsten. And there's a comment in the chat about the importance of supply chains as well in procurement and commissioning of food. So very, very important area. That's great. I want to, if I can go to Anya next, just go back to the comments we were making around working with the commercial sector, and just aware with your work with FCDO, I mean, British aid tends to be linked with commercial opportunities as well as aid, especially with a combination into one FCDO. I mean, any reflections on how we positively work with the sector and you know, messages for us here on this afternoon?
Yeah, thanks, Paul. I think the kind of most important message around finance is that there is absolutely a held belief that there will not be enough finance without private finance that needs to come from the private sector. And there were some climate and health financing principles coordinated by Rockefeller, which were launched at COP28 and then endorsed by a number of different organisations. I don't kind of have the list to hand. And the UK has been very involved in the development of those principles and getting those over the line. There are two really important questions now, though. One is, these are only principles that are voluntary and people can sign up to them or not sign up to them. But the thinking behind it was that whilst lots of global health funding and financing has already kind of evolved in a very complex and slightly duplicative way, there's still enough of an opportunity and a space in climate and health to try and do it a little bit better. And maybe try and make it and design it from the outset in a way that works best for the countries where the financing is intended to go. And so And the thinking behind these principles was that organisations, whether they be private organisations or others, that they could endorse these principles or use those principles to think about how they set up climate and health finance and funds for low and middle income countries, particularly to access. So it is a very important part. The work is only just beginning, really. So those principles were the start, and now is the hard work about thinking and working on actually setting up the climate and health funds that will be available for countries to access, and then defining the role of the private sector within that. But it is very, very high up on the agenda of the people working on this to think about clearly define.
Thank you. That was really, really helpful. I'm going to just slightly change the topic and look at global issues next, and then I want to come back to communications and working with communities. But going global first, I'm going to ask Abdul if you could give us a reflection on what we've heard today as well. I mean, you and I have worked internationally before, and you know, I'm always aware of the vast chasm between different countries, even in the West, but let alone north-south. And the messages are stark from many countries, particularly in the global South. What can the faculty do? What can we do to help really address some of these issues? We've heard from Malik today, some great insights there, but you know, we probably just need to move this into a more proactive rather than a passive reactive mode. But Abdul, your insights, welcome.
Thanks, Paul. In terms of, you know, I think that in terms of what the faculty can do, clearly sharing best practice, sharing, you know, some learning, really. Basically, those networks clearly already exist in some shape or form. Our special interest groups, really. I mean, climate should be within not only the climate and change kind of SIG, it should be throughout every SIG that exists. So I think ultimately, so, you know, we need to think about really exactly how each SIG within the faculty can actually, you know, kind of promote climate change and health kind of impacts really through all of our networks that we actually then have. So it needs to be built and embedded really within all of our kind of work. In terms of the what else can we do? You know, clearly, I think we need to keep a social movement and a momentum going. In terms of seeking or influencing and lobbying, you know, I think there needs to be more conversation and dialogue as we go forward, really. And I think we need the public's voice really at the heart of this, you know, as part of the process. So the faculty can actually, you know, engage or assist through other routes to actually bring the voice of local kind of communities, nations together in terms of saying exactly and sharing, you know, those experiences, because this is a global issue, and you know the issues really faced by India, Pakistan, Bangladesh, you know, with their torrential downpours, and a third of countries such as Pakistan actually being underwater at any one point in time, and you know, billions worth of economic loss which they haven't actually recovered, is having huge impacts on but then the impacts on our communities is migration. So basically, ultimately, if there's no opportunity and there's, you know, those impacts actually being felt by communities, whether they be in the global South, you know, in South, you know, South Asia really, or Africa, the net effect really will be those individuals who are able to do so wanting to migrate into other parts, other regions, and that is, you know, going to cause lots of health impacts as well as kind of social impacts for our, you know, for our global community as well. So they're both opportunities, but also pose significant challenges as well. So I think ultimately it links with migration and health, you know, links in really with economic development and clearly those types of things as well. But the diaspora really within all of our communities clearly also play a role. So the faculty does have a role to actually link in with the African, South kind of Asian communities, the Chinese and other communities, to be able to, you know, tap into their expertise and their knowledge base, because there's lots of traffic between our communities into those areas on a regular basis. So those would be my initial thoughts, really, Paul, and hand out back to you.
Yeah, no, thanks, Abdul. That's great. I'm just wondering, Rebecca, from your position as a student coming into the profession and potentially, I hope, public health, but you never know. What's your reflection on working internationally? I mean, maybe some of the work you've been doing on the scorecard, for example, might make you more aware of some of the gaps, perhaps, that we've got.
Yeah, we actually had a kind of international meeting the other day with a few different students from other countries. So there was like a student from South Africa and a student from Australia, and we kind of discussed what our different countries are doing. And we found it was quite interesting because Australia is doing quite a lot to do with nitrous oxide. And then from South Africa's perspective, she was saying it was quite encouraging to see the work we'd been doing in our countries. So I think sharing ideas and understanding what our countries are doing, especially from a student perspective, and lobbying our countries to take those actions can be quite beneficial, especially like different effects that are happening in different countries. So I think really understanding what's going on in every country and trying to share a view like in a global stage can be really useful and beneficial for students.
That's really important. That's great. Thank you. Anya, any quick reflections on global before we move on from your perspective?
Yeah. I mean, I think that the reason that I took on the role that I'm currently doing is that obviously this is a global crisis, and we as a well-developed rich country that's used a lot of fossil fuels have also got a duty to support low-income countries that are going to be worst affected, as well as in public health. Obviously within the UK we need to protect the vulnerable communities in the UK as well. But what my kind of role involves is thinking about how we can hear from communities, and one of the things I've fought really hard for is how we can make sure that the priorities of the local communities is then what we end up funding, and not something that maybe is more our priority. And that is working quite well, but it is something that's a new field, and it's only been around as an area of development funding for a year or two in the UK. So a lot of work to still be done, and a lot that we can learn from other sectors and other kind of development areas for how to do that really, really well. And it's so important.
No, that's really helpful. Thank you. I'm going to pick up working with communities next, actually, but I'm just going to say, I'm going to ask each of you to say a very quick summary of your take-home message in about 20 seconds at the end. So we'll do a quick round. But before we do, I just want to go back to, and I've had many questions. Thank you so much. I'm not going to be able to cover all of them, but we've had a great response to questions. One of them is about messaging. How do we, in our roles as public health leaders and practitioners, how do we get the message right here? One of the things I learned very early on is people respond more to positive messages than negative messages, and our problem in this agenda is that there's rather a lot of negativity. Can I ask how best we work with communities? How best do we get the messages across that are going to make a difference? Kristen, I'm going to start with you.
Oh, wow. So, I mean, one of the events I went to that had the most impact, and I think you may have been there too, Paul, so I saw your notes go around, but it was where they talked about the Pathfinder work, looking at the lives that could be saved if we were to do three things, which is to reduce fossil fuels, improve diets, and increase active travel. That both has co-benefits to the carbon and emissions, and to health, 10 million lives from diet. Now, how you translate that message, those lives saved, that positive message down to a local community gets quite tricky. And I don't know that we've landed on that yet. And that's actually one of the key action points I've taken home for myself, is how to take this rousing is the only way I know how to say it, and really inspirational, like, oh my gosh, this is the way to describe the problem, is in health terms, because it's meaningful to individuals. Melting ice caps, rising waters feels really abstract. The possibility we could be dying of getting mosquito-borne illnesses in London has a bit more resonance. So how do we translate those big picture messages in a positive way down to local communities? I don't have an answer. I wish if I had an answer, I would be very impressed with myself, Paul, but I'm tasking myself with finding a way to make those big picture messages meaningful to local communities. It's challenging.
It is, yeah, hugely. Abdul, any reflections on this, your work? you've mentioned it before, but anything particular, any take-home message?
I suppose really, Benjamin Franklin actually once said, really, when the well is dry, we know the worth of water, basically. So I think we will basically, we don't want to reach that point really when we actually basically when the well is actually dry, and basically we've got a scorched earth, you know, from a number of kind of impacts really. So that's my take-home message really. You know, basically, you know, the message really clearly, you know, has to be both positive in terms of positive messaging, which with the question, Paul, that you raised, but also remind you really that what our future generations, because this is really about our future generations as well as our generation, in terms of what habitable planet we will be living on, and the way we will actually stay in life on planet Earth, which is for all of us. Thank you.
Yeah, no, thanks, Abdul. Quick reflection in a few seconds. Anya, what are you taking away before we wrap up the panelist?
So taking away, I think for me, it's the most important thing to think about, well, what's the role of the UK public health workforce in then influencing this agenda moving forwards? And I think that we have a role in two things. One is that community building and mobilizing people into action in our local communities and where we work, and would love to pick that conversation up with people who are interested to think about it in their roles. And then the second piece is thinking about that, you know, public health professionals are trusted. We've got access to like a lot of senior decision makers, or we are senior decision makers in some sense, public health people. And to influence government policy in the right direction, I think is a huge strength and opportunity that we have. And the faculty work will be moving into that next year in this space as well. So do stay tuned for that. And I think that's the most important thing. Thanks.
Oh, great, thanks, Anya. Rebecca.
Yeah, I feel like COP recognising the link between health and climate should be seen as a turning point, and healthcare students need to recognise that this was addressed at COP. And I think for me, educating students and staff in this area is really, really vital. But we also need to work with other countries, especially countries who are facing the brunt of these issues, and try and work out how we can best support them. Thank you.
Thanks, Rebecca. That's great. And Abdul.
I don't think I've got anything further to add, really, Paul.
Yep. Okay. Thank you for that. And Kristen.
My overwhelming feeling is I need to prepare for next year's COP. And, you know, because everything that we've taken from this, so next year, what can we do better? How can we influence more? And, you know, where are the pressure points we really want to lean on to make the bigger changes that we didn't see this year? So in addition to the local changes and the, you know, building capacity in the workforce, I think looking forward to next year's COP is also something I would like to put in the mix as well.
Yeah, great. And I would like to work with you on the food agenda as well. I think that's going to be a really important area. But can I just say a huge thank you to you, the panelists. That was a fantastic conversation. Lots to think about, lots to do. Many questions as well I had, so I'm sorry I didn't cover all of them, but I think we've got most of the key points. Just on messages, we have actually just agreed with the ADPH for a joint statement following COP. Which a few of us here were involved in. We had an interesting debate as to how positive and how negative we should be, and I think we've probably got it right. But welcome your view. I'll just post it again so you can have access to it. But thank you again. I'm now going to pass over to Maria van Hove, and many of you know Maria is co-chair of the SIG, the Specialist Interest Group on Sustainable Development. And she's also going to introduce, I'm really delighted to say, Andy Haynes, who's been listening in as well. So over to you, Maria. Thank you.
Hi there. I'm really excited to be here with everyone. I've just wanted to take a couple of minutes to talk about the work that the SIG is doing. So we have a work program focused on that's mainly around improving knowledge and building capacity among public health professionals and supporting them to work on climate change and health. And we also engage in some advocacy in the climate and health space, working with partners such as sometimes the UKHSA, UK Health Security Agency, and the UK Health Alliance on Climate Change. And we have in the last year decided on one of our focus areas for advocacy should be ending fossil fuels. And I think that the developments at this COP really have confirmed that that was the right decision, and that is a really important focus area. And I also think it's clear now that we'll experience a degree of warming that has major and long-lasting health effects in all areas of life, with a 2 or 3 degree scenario being quite likely. And what this means, I think, is twofold. First, I think as a public health community, we need to think about how we can adapt to this vastly different world and how we can protect the most vulnerable in society. And the second thing is that climate change will play quite a major part in every public health professional's work life, and we need to upskill our workforce to be able to address these challenges and find the gaps, provide support, include this stronger in the public health curriculum and in exams, so that we are, as a profession, are better equipped to operate in this very different world that we're heading towards. Yeah, that's most of what I wanted to say.
Thanks a lot, Maria. I think I'm to introduce Andy, aren't I? I just realised that.
Sorry, can I just say one last thing? Sorry that I forgot. I have put a message in the chat. If you do want to join the SIG, there is a mailing list that you can email. I'll put it in again. We have about 200 members in the SIG, and it's a really active group. Very exciting work going on, and very good people in there. Thanks, Anya. Anya's just posted it again in the chat. So if you do want to join, get in touch. There's a form to fill in, but if you email that email address in the chat, then we can help you out. Okay, back to you, Paul.
That's terrific. Thank you very much. Andy, can I check you there? Yes, you are. Great. Very warm welcome. Introducing you, Professor Andy Haynes, who has been very much a mentor for us as we at our meetings, and I think you are quietly in the background helping us, guiding us along the way. So, Andy, just a few reflections on what you've heard today and what we should be taking home. Thank you.
Great. Well, thanks, Paul. And can I just check you can hear me all right?
Yep, fine.
Look, I mean, thanks so much for inviting me to just say a few words. And can I just say that it's been really inspirational, the panelists and the speakers and so on. It's been a really positive occasion, I think. I think we've heard already that it's taken a long time for health to get on the stage at COP28. I was actually in Kyoto in 1997. I think there were about 3 health professionals there. And for many, many years, we were really very much consigned to the sidelines. But as we've heard now, there has been a step change. The door is now open, and it's for us, I think, to walk through and ensure that in subsequent COPs, whether that be in Azerbaijan, in Belém, Brazil, in Australia, that health has an even more prominent position. I think it's been inspirational to see people from outside the health field, like John Kerry, for example, saying that health needs to be centre stage. If we look at the health declaration, I think that is also a step forward, but I would say a partial win. It expresses grave concern about the negative effects of climate change on health, and it mentions the importance of policies that maximise the health gains from mitigation and adaptation. But notably, it fails to mention the need to phase out fossil fuels to achieve the Paris Agreement targets and prevent the more than 5 million premature deaths that we estimated recently annually from ambient air pollution from the burning of fossil fuels. So it's a step forward, but health is still not a focus of the negotiations themselves. And when we look at the global stocktake, it's just been approved by the COP28 participants, it proposes transitioning away from fossil fuels in energy systems in a just, orderly and equitable manner, accelerating action in this critical decade. But it also proposes accelerating the uptake of carbon capture, utilization and storage. So it's a bit of a mixed message. And we need to make absolutely crystal clear that what we need is a phase out of fossil fuels. But of course, the poor must have access to clean, renewable energy. So it has to be a just transition. And we know that there are profound inequities. So for example, the top 10% of the global emitters are responsible for virtually 50% of emissions. And even in the UK, the highest income decile has energy use that's 6 or 7 times more than the lowest income decile. A lot of that's because of the use they make of air travel and travel by car and so on. So there are big inequities. So we also know that there's a tremendous need for financing. And although there is money on the table, it's vastly inadequate. I mean, the wealthy countries have pledged over 700 million to a loss and damage fund, but that's a tiny, tiny fraction of the necessary funding. So there's a lot that we have to do on the global stage. But very, very briefly, what can we do in the UK? Well, first of all, I think this idea of integration of adaptation and mitigation is crucial. We need to stop these kind of silos between these two types of climate action and avoid maladaptation by fostering a climate where we can integrate these different policies. We do need to attribute the climate change impacts on health to climate change. And increasingly through advances in science, attribution science, we can do that. We can say that this event was most unlikely in the absence of climate change, and therefore the health impacts of that event can be attributed to climate change. And we need to foreground that, I think, in future evidence. I very much like the idea of public health 2.0. I've been arguing that we need a new public health for the Anthropocene. The Anthropocene is the epoch we're now in which we see these dramatic environmental changes, of which climate change is arguably the most important. But of course, as we know, 6 of the 9 planetary boundaries are being breached, and we need a new public health that kind of integrates this perspective into health and equity. There's going to be a lot of pushbacks, a lot of fights, of course, partly because some of the actions that are being proposed bear unfairly on the poor, who tend to drive more polluting vehicles, for example, because they can't afford cleaner vehicles, and often are subject to inadequate public transport and a whole range of other disadvantages. So we need to make that case that policies need to be fostering equity. I'm absolutely convinced by the need to co-design actions with local communities. And I think it was Kristin that mentioned the Pathfinder report that we released a few weeks ago. And the idea of having local community-based co-designed pathfinders that actually capitalize on the co-benefits of climate adaptation and mitigation, I think is truly exciting. And I think that's where the faculty can play an important leadership role. So in concluding, let me just say that despite the dangers ahead, it's really important to communicate a positive message, partly also to combat disinformation, which thrives in an atmosphere of negativity. And I think the faculty is really well placed to articulate that vision of a clean, healthy, net zero carbon future. Thank you very much.
That's great. Thank you very much, Andy. And welcome. We look forward to working with you on the Pathfinder initiative. We've just put the link in the chat as well for everybody. So it just leaves me very quickly to say a huge thank you, not just to our speakers and panelists, but I want to particularly thank Davina Sharma. Davina is in the London Hub. I don't know if you want to put your picture on, but she's been the star in coordinating this alongside Laura in Edinburgh and Shane and Izzy in London, under the auspices of the COP working group chaired by Anya and Maria. And I want to just thank the faculty as well. We've had Heather supporting this today. And I want to just make a note for David Parkinson, our comms director as well, who's helped us with a lot of this work, but this afternoon with the statement we've just published. We're going to be using all of this material. We will be reflecting on this in our work plans next year. Finally, can I just say, thank you very much for everyone for joining. Have a very restful festive season and look forward to working with you in 2024. Thank you very much.